Okay, let's get started with the third and last part of this topic, which is going to be the surface anatomy of the lungs. Again, we're just going to go through the anatomy of the lungs real quick and very briefly. Remember that the lungs are two spongy organs that should be pink in a healthy individual, that are found on either side of the thoracic cavity. And remember, this central part here that does not contain lung tissue is referred to as the mediastinum. This is the larynx over here. This is the trachea continuing down and then bifurcating at the level of T4 into the two main bronchi. Okay, so the lungs are the major organs of the respiratory system. They are the parts of the breathing system where gaseous exchange takes place. And they are, like I said, they occupy the lateral regions of the thoracic cavity. All right. Each lung has an upper part that extends. I'm very, very sorry. That extends into the neck, which is called the apex. They have a mediastinal side, which is basically the side of the lungs that faces the mediastinum. And this is the region where the bronchi enter the lung tissue, where arteries pass in and veins pass out, which is called the hilum of the lung. And there are two of them, of course, that are right and left. And you can see that the anterior border of the left lung actually has a depression or a curve on its side. And this is the region where the left ventricle kind of just presses the lung tissue away to kind of make room to sit comfortably. And the lungs, of course, are dynamic organs that have the ability to increase in size during expansion and go back to their normal size with expiration. And it's just kind of let the air out. Now, each of the lungs, right and left, are divided into smaller subdivisions, which are called lobes. And the lines or regions that divide the lung tissue are called fissures. So sorry, my bad. Any line that divides lung tissue is referred to as a fissure. Now, when comparing the left with the right lung, you can see that the left lung only has one fissure that kind of passes in a curved manner around the surface of the lung, and this is called the oblique fissure. It divides the left lung into one superior lobe and one inferior lobe. With the right lung, you've got two fissures. One of them, similar to the left lung, is the oblique fissure, and the additional one is one that passes right across the surface of the lung in a straight line, and this is called the horizontal fissure. And what it does is it divides the right lung into three lobes, which are the superior, middle, and inferior lobes. Okay, so that's one of the things that helps you differentiate the left and right lungs, which is the number of lobes that they have. There's another set of features that you guys should know, so make sure you guys are able to differentiate between the right and left lungs. Alright, so let's take a look at their surface markings. Greetings again. Okay, so I went ahead and drew the surface markings of the lungs beforehand, just to save time. Okay, so the thing to keep in mind with the surface markings of the lungs is two things. Number one, the lungs are dynamic, meaning that they're constantly changing position between expiration and inspiration. So we can't really pinpoint a specific surface marking per se, but we still give you a kind of outline as to where they're found in the thorax. And to figure out the surface markings of the lungs, what you do is you take the same surface markings of the pleura, and then you subtract 2. Okay, so for any point that we had in the pleura, you just subtract 2, and then you end up with the same with the surface marking of the lung. So let's see how that works. Okay, here this is the clavicle. Okay, and then you've got the first, second, third, fourth, fifth, and sixth ribs, or coastal cartilages. Okay, so if you follow the blue line, okay, there's a part of the lung that goes above the clavicle as well, and that's called the apex of the lung. Okay, and then we're going to do the same thing where we follow down the side of the sternum. Okay, and instead, if you remember with the pleura, we went all the way down to the sixth coastal cartilage. With the lungs, what you're going to do is you're going to stop at the fourth. Okay? And then with the fourth, once you reach that, that's when you start curving it back. Okay? So remember with the pleura, I curved it back at 6. With the lungs, I'm going to curve it back at 4. And then we follow the same line, so we curve it back, or curve it to the side. Okay? Now if you remember with the pleura, once I reached the level of the 8th coastal cartilage, I was in the mid-clavicular line. Okay? I'm going to be at that same level in the mid-clavicular line, however, I'm going to be at the 6th rib, okay, or 6th coastal cartilage. So, for the pleura, it's 8 at mid-clavicular line. For the lung, it's going to be at the level of the 6th. Okay? If we continue, if you guys remember, when I reached the 10th coastal cartilage, I was in the mid-axillary line. Okay? For the lungs, when I reached the 8th rib, and 8th coastal cartilage, that's when I'm going to be at the mid-axillary line. Okay? And then when I reached the 12th rib with the pleura, I was in the paravertebral region. Okay? With the lungs, to reach the when I reach the paravertebral region, I'm going to be at the level of the 10th rib. Okay? So the idea is you just subtract 2. Okay? And the same thing is going to apply on the left side. Okay? But you're just going to have the same curve. And the line of the curve is going to be behind the 5th and 6th coastal cartilages. But again, you're going to be mid-clavicular line, 6th coastal cartilage, mid-axillary line, 8th rib and coastal cartilage, and paravertebral region in the level of the 10th 10th rib. Okay? So it's relatively easy. If you guys figure out or manage to understand the surface markings of the pleura, the lungs should be a breeze. All you have to do is subtract 2 ribs for each level. Okay, so I hope that video was clear and clarified the surface markings for you. And we'll just continue with the lecture now. Okay, and that concludes the topic of the surface anatomy of the respiratory system. As always, I will put up a discussion forum for you guys. Feel free to ask any questions and discuss any points that you feel you need to work on a little more after watching these videos. It is 1:16 a.m. and I am exhausted, so I will see you guys when I see you.